Hi, this is Dr. Tim Conley with Yeshiva University, and I'm going to provide you with a brief lecture on non-alcohol sedative hypnotics. Sedative hypnotic drugs represent a diverse group of chemical agents. They depress the function of the central nervous system. They really calm you down. They reduce anxiety. They you stop your nervous jitters. They'll help you sleep at night. They're used as anti-anxieties called anxiolytics, sleep inducers, hypnotics, anticonvulsants, includes muscle relaxants, and sometimes they're used to help with anesthesia to relax a person before they go into a full, get fully anesthetized. Um, they In the 1950s, they were invented. It opened the era of benzodiazepines, and you will hear these referred to as benzos. Is probably the most common term for them. I refer to them as the PAMs because the names, if you look at the list, they all seem to end in PAM. We'll get to that in a second. But by the 1970s, widespread clinical use of benzos as anxiety relieving and sleep inducing. It's like, oh, you'd watch a movie. We better give him something for sleep, or we better give her something for sleep. The poor thing is so upset. A sleeping pill, or something to calm somebody down. That would be a benzo. It was about by the 1970s, when your professor was a teenager. They accounted for almost 10% of all prescriptions written in the United States. There was sort of a benzo rage. They were all over the place. If you look at your list in the textbook, alprazolam, clonazepam, there's diazepam. That was a big one. Diazepam, flurazepam. Anything that ends in a pam, and I'm like, you're on a benzodiazepine. There's more recent invention of your non-benzodiazepine sedative hypnotics for sleep, epsicolone and Zalepalon. They go by different. You have to be careful with the brand names. If a client is taking a prescription and you're not really sure what it is, look it up. The internet's a wonderful thing. Just Google it, figure out what they're on, see if it ends in PAM. Not always. I mean, your epsicolones don't, or epsiclones don't, but check and make sure it is one of the most frequently prescribed medications in the United States. It remains. Sometimes they're used to relieve acute pain, always for anxiety, always for insomnia. Doctors are very quick to reach for the prescription pad with someone who's having panic attacks, and they can be very good for the treatment of panic disorder. There are some downsides to these things we'll talk about in a minute, but they're effective medications. It's a reason that there's almost 47 million prescriptions written a year. Your muscle relaxers are very used for the treatment of lower back pain, which, I mean, who doesn't know someone who has a back issue, right? Muscle spasms, et cetera, et cetera. So they're out there. They're pretty highly used, but they come with a price. All good medications seem to come with a price. The most serious drug-drug interactions are when you take a sedative hypnotic and combine it with another central nervous system depressant like alcohol, opioids, another muscle relaxer, et cetera, et cetera. That combination has been responsible for the death of many a rock and roll star in the music industry. People in a high stress position like stage performing are going to be all ramped up. They may drink to calm down. They may take a pill. They drink and take a pill and they get the wrong combination and they will die from it. They'll pass away. Also, opioids and benzos are a problem. You can't be taking hydrocodone, OxyContin, etc., and Xanax or any of the other sedative hypnotics. It will result in an overdose. That is the most common pretty much the most common type of overdose there. As the unhealthy use of prescription opioids has increased, there's an understatement. It's now February of 2021, and there's a raging opioid epidemic out there, people addicted to those. But as the opioids have increased, the interaction has become an increasing concern. There's extensive evidence implicating benzos as a class of drug in both fatal and non-fatal opioid overdoses, people who are taking both. Sometimes a physician will try to manage opioid withdrawal because with a benzo, because coming off of opiates is so uncomfortable. You get muscle spasms. You get, lower intestine is just trying to empty everything out. And so a physician may try and treat that with a benzodiazepine, but it's a real art and science to get that right. And it's why it should be medically managed and often in an inpatient setting, so that if anything goes wrong, um, it can be taken care of right away. Um, Benzos are prescribed for the treatment of pain. As I mentioned, they may be used in combination with what do you call it? Non-steroidal anti-inflammatory NSAIDs, non-steroidal anti-inflammatory drug, NSAID. So anti-inflammatories or an analgesic like Tylenol, along with a muscle relaxer, etc. There is tolerance. It's evidenced by decreased responsiveness of certain receptors to benzodiazepines. It's been really well documented using electrophysiological studies, etc. Not to belabor the point, but there is a very high addiction liability with these, and the withdrawal from these is extremely uncomfortable. They the criterion of euphoric positive response in people, you take them, you wait. It's not like it's smoked, injected, or intranasal. Remember, those are the quickest means of getting something into your brain. But you take the pill and wait, and it will kick in and create a euphoric sense. It takes away the pain, so there's positive reinforcement. It takes away the anxiety. There's positive reinforcement. It feels good to take them. And eventually it feels bad just to not take them. Not that the condition you're taking them for returns, that may be the case, but you've brought on a whole other problem. I've got, from most recent textbook, almost 48, close to 50 million prescriptions written in a year for these. People with opioid use, we said, are at high risk. People with anxiety disorders, long-term unhealthy use. None of these things, nobody should be on these as a regular thing, because you'll develop tolerance for them. They stop working after a while. It takes more to get the same effect. That is one of your DSM-5 diagnostic criteria, is the tolerance. High tolerance usually leads to withdrawal syndrome. You've got 2 out of the 11 criteria. A person who is on these medications all the time will start failing to fulfill major social role obligations. It causes problems for people around them. They may be taking the medication even though it aggravates some other condition. You can look at your diagnostic criteria and see how these can very quickly become a problem. So that's our non-alcohol sedative hypnotics part of this lecture.